Hello, everyone, and welcome to our webinar on today. At this time, I'm going to turn it over to Sabrina Moore, who will do our introductions and get us started. Thank you.
All right, yes, good afternoon, everyone. We'd like to welcome you to the Children and Youth with Special Healthcare Needs Mental Health Crisis Care webinar. As mentioned, my name is Sabrina Moore, and I'm part of the Regional Support Center team hosting this webinar today on behalf of the New York State Department of Health, Children, and Youth with Special Healthcare Needs program.
Hello, my name is Mariela Leon Thomas, and I'm also part of the Rochester Regional Support Center team. Before we dive into our content-rich presentations and hear from our esteemed panelists today, let's go over some webinar etiquette to ensure a smooth and productive session for everyone involved. So first, reducing background noise. To minimize distractions and background noise, we have muted and turned off video for all participants. This will maintain the focus on our speakers and the valuable information they'll be sharing. Secondly, questions. We encourage curiosity and engagement. If you have a question, please feel free to share in the chat or raise your hand, use the feature in the bar below, or type a question on the box in your screen. Rest assured that we have dedicated time for a Q&A at the end of the webinar, where we will review and answer your questions. And finally, recording and feedback. Please note that this event is being recorded. We value your feedback greatly, and a link to the survey will be sent to all attendees after this meeting. Additionally, the survey link will also be shared in the chat during the webinar. For interpretation instructions, we are thrilled to offer interpretation services for this webinar to accommodate our diverse audience. So here's how you can access this feature. First, you can locate the interpretation icon. Look for the globe icon at the bottom of your screen. Second, you can select your language, click on the icon, and select the language you prefer to listen to the webinar in. Third, mute original audio. After selecting your language, you have the option to mute the original audio to only hear the interpretation. And lastly, unmute for original audio. If you wish to switch back to the original audio at any time, simply unmute it. We are committed to making this webinar as accessible and informative as possible to everyone. So let's embark on this journey to enhance our understanding and support systems for children and youth facing mental health crises. Thank you for being here with us today. Let's get started.
So at this time, we'd like to introduce our guest speakers. Dr. Ken is a licensed pediatric psychologist and a licensed doctoral level board certified behavior analyst in New York. He is currently the director of IDD Behavioral Health Services for Developmental and Behavioral Pediatrics at the University of Rochester Medical Center. His professional training is in the use of behavioral and cognitive behavioral approaches with children and teens with neurodevelopmental differences. The majority of his practice focuses on supporting families with common developmental concerns, such as toilet training, sleep, and behavioral management. His approach emphasizes the careful consideration of parent concerns and challenges as they try to help their child develop to their fullest potential. He has over 20 years of experience in behavioral health across school and community outpatient programs and university medical centers. He currently practices with the Division of Developmental and Behavioral Pediatrics and Pediatric Sleep Medicine. Our next panelist, Jessica Wadington, is a licensed mental health counselor in New York State, currently working as the Chief of Children's Behavioral Health Services at Monroe County Office of Mental Health. Jessica received her bachelor's degree in psychology from SUNY New Paltz, followed by her master's degree in mental health counseling at SUNY Albany. Jessica began working for CCSI in 2014 as a family access and connection team facilitator, and then was hired for the Monroe County Office of Mental Health as a child and youth SPOA facilitator. And from there, she's grown professionally into her role of a child and youth SPOA supervisor, planning and program manager and training coordinator, and most recently, the chief of Children's Behavioral Health Services. And outside of working for Monroe County Office of Mental Health, Jessica has worked in a variety of behavioral health settings with both children and adults. She's worked as a residential care, or she's worked in a residential care facility with children placed through OCFS, also as a clinician at a PROS program for adults with severe and persistent mental illness, and as a therapist at an outpatient clinic. She's also done work as a shift lead for a 211 Lifeline's crisis phone line. And then finally, we have Manny Rivera, who is the Child and Youth Single Point of Access Supervisor for the Monroe County Office of Mental Health. He graduated with degrees in outdoor recreation education and music from Houghton College, and Manny has worked in various levels of residential care within OMH. And in the community, working with families and youth with mental health needs for over 15 years. So welcoming our panelists, and thank you.
At this time, we'll turn it over to Dr. Ken. I will stop my share at this time.
All right, thank you, everybody. I'm going to just give me a second here to share my screen. Okay, so thank you for having this opportunity for me to join. In short, this panel and this webinar, again, I thank you for the introductions as well. I don't think I have to spend too much time kind of reviewing all that, but one of the reasons I think I was invited here is because one of my specialties as a provider and the focus of a handful of our programs here in developmental behavioral pediatrics actually include overseeing some really kind of programs that focus on challenging behaviors in clinic and also challenging behaviors that are happening in the home communities. So we have several programs that kind of span both areas. And, I just also wanted to really kind of take a moment here to say that I realize the topic about, for today is really about mental health crises and what we can do to be supportive and intervene. I really want to say first, thank you to all the parents, all the caregivers and professionals who interact and provide care for our loved ones that are affected by developmental disability. I sincerely appreciate your passion. It certainly has been a calling for my life. Secondly, I did struggle with what to share with folks today. In short, I hope that it's of help to anyone who might be here with us. But I settled on the idea of some of the communication between those who might be experiencing a crisis and those who are likely to get involved to support them. Because I do think that it's really kind of sometimes what happens before and after the storm. And I do think that what we can do there certainly helps us really kind of communicate with the people if we're actually in the middle of a crisis, and whether that's, we can use the term mental health, we can use the term behavioral health, but really it's something's going on and it's not, something's probably not safe, or it's maybe getting to a point where it's not safe and we need to kind of recruit some help. Because I will say that, one of the things in my experience is that it's pretty rare for a family to have like one simple crisis. In fact, most situations, usually there's some underlying challenges. And either for some reason, all of a sudden they get bigger, right? And sometimes that's really just as simple as your child actually getting bigger. And that means there's different consequences to it. But there's many reasons why a certain thing could worsen and worsen very quickly. So two questions I'm going to focus on for the brief time that I have with you today are that, what information would actually help providers help you just, what information would you be able to provide them so they could help you better, but also, some ways that we could maybe help you communicate clearly about what you observed for your child before and after the storms, and of course, hopefully during the storm as well, where you might be on the phone with somebody or something like that. So I, in trying to find a way to connect these thoughts, I simply started to refer to making sure that the communication that we have is really clear, concise, concrete, and continual. So I'm going to kind of like lay those things out there as like some thoughts around this. So as a caregiver or provider, like, what are some things that help us accomplish those particular kind of goals, those headers? And if we can put all that together to help you describe and talk about your child's patterns and maybe the severity. And I will say that, I'm going to say step one, and I'm going to repeat this a little bit later again, is that we really need to figure out first, how are we going to start thinking about collecting this information? There's lots of ways to do this, but in general, I always like to say, like, we need to find a way to kind of actually get it down. We need to write it down on paper of some kind. We need to figure out a way to log it. And so one of the things that'll share in the slides, when the slides are shared after this webinar, is, maybe some links to a box folder that you'd be able to access, some things that we use as pre-recorded kind of forms or preset forms that might help collect some information for, again, as you're sharing information about your child, especially these challenging behaviors that lead to crises or maybe that happened in crises. But it doesn't have to be that, right? Like, it could be a specific notepad on the fridge. It could be a data app that you have like on your home screen or your phone or tablet, because sometimes these apps you can just kind of like forward the information straight along to somebody, and you don't have to actually worry about like faxing, taking photos of like your forms and like sending it to like maybe a provider that would need to know, or you'd want them to know this information about what's happening with behavior for that has, again, happened in previous crises, or as we'll talk later, maybe like what the plan is, right? And what they should know if they're coming to your house to provide some support, or if you're taking your child, unfortunately, to the ED, perhaps, like, how would you share information about them so that you don't have to reinvent the wheel? You don't have to necessarily worry about things getting missed. And all these things certainly can happen in the context of a crisis, because none of us are usually thinking very clearly. We're just responding to making sure everyone's safe, and we're probably getting some support. So the first thing, just to kind of put this together is, we do want, it's going to be helpful for you to always be clear. And that's why we think about, again, like maybe some preset forms that maybe help it make it clear. Like, what is it that someone needs to know to help you? They need to understand the crisis might be in the moment, and also maybe some things that are happening in the past, right? It's very easy to say like what's going on in the moment when things are really bad. So if you're on the phone describing things to someone, you're saying like, my child's kind of just going crazy, because that's kind of like maybe what we talk about, how we talk about it and what looks like it's going on. But again, it's a very simple example, but in the last 3 hours, right? Like, what have they done? Well, we can put some anchors on this. We can put some like things like time, number, and whatnot to help give some clarity and answer a lot of the who, what, when, where, how long, the WH kind of questions that they really know. And this is going to help them do a couple of different things. One, it's going to help by being clear, by kind of like doing the WH kind of questions and thinking about these things when we're describing like what's going on. Again, this could be before or during a crisis, is really help us be concise and concrete. A lot of times using numbers to describe how often or how long a behavior is happening, really does, go a long way. It does provide what I say is like an anchor, because when we try to describe behavior, it's actually really hard for people to picture. You say like, oh, he had a real big episode. When people tell me as a clinician, like, well, he had a really big episode, my range of what is big or severe is kind of like, well, did they dislocate an eye? You know, did they act, you know, part of like a bone? Did they, you know, maybe also, you know, partially like knock themselves unconscious for a minute because they hit themselves so hard on the floor? There's a wide range, right? That's severe to me, but what's severe to you? We need to kind of sometimes get a sense of like what are things that are going on. And so numbers can really kind of help us describe some things rather discreetly, and give you an idea of, again, how long the behavior is happening and thinking about duration of the intensity and the frequency and all these kinds of notions of, again, these WH questions of around a behavior. And while it shouldn't be necessary, it really does. The more that you can kind of think about things in this term or communicate this knowledge to another provider who you're looking for help from, right? Especially around tough situations or challenging situations that are come up, it kind of really helps establish you as a reliable reporter, right? There's many biases that we all have when we start to encounter other. The more that someone has details or, you know, facts, the more that believable they are. You are already the expert on your child. And so by being able to use these kinds of ways of being concise and concrete, helps them understand that not only are you going to be the expert on your child, but you actually seem like you have such a grasp and understanding of like what's going on that they don't doubt. They don't have to like make any guesses. They don't have to let their own biases maybe start to infiltrate in terms of like how they might help you out. And so I find that as like a real kind of like strength in terms of being able to help people be specific. It also helps the person on the other end, right? Predict what support you need now and in the future. So the more that you can describe more specifically with answering the WH questions, putting numbers on it and anchors, that you would be able to actually recruit help that is appropriate for what you need now, and then also maybe what you need later. And so we're kind of telling the story, but telling the story in a way that actually helps people do things in the moment, or as you interact with them, really understand like where to place you. We have lots of outpatient programs, or we have lots of programs in the community, or we have other kinds of like potential residential, or other kinds of, well, we hope there's residential options. Those are hard to find. Or do you need to go to the ED, right? Like I think those are things that we need to kind of understand, and those certain kinds of information help us get at that point more quickly. And then what I'm suggesting to you today is kind of some ways that communicating to them help get you perhaps the right level of help more quickly, and maybe doesn't create more stress by getting put to the wrong area, talking to the wrong person. I want to stress again like how important it is for kind of like making this collecting of information continual. I've already talked about like writing or logging it down, but continual means that like in addition to being clear, concise, concrete, that we're keeping track of this over time. There are certainly instances where things happen and it's just like one time. But that's not usually the case. Usually if it happens once, it might likely happen again, or maybe it's been happening for a while, or it's been leading up to it. And so keeping track of the good times, the bad times, and how those are happening over time can be very important. When are things going well, and when are things not going well? When did things get worse or better? And that'll help people understand like the bigger picture. Again, what people share with us as, maybe to a provider, really helps us understand, okay, so if this has been happening for 5 years, getting this really predict, again, who we might need to interact with. Whereas if it happened in much more brief times, then maybe that would suggest that we need something else. So writing or logging the good times and the bad is really good, because again, our memories, they're just not really very reliable. We have our own biases, and that's just kind of like how our brain works. And so we construct our perspective of the world. It's not always exactly how the world is. And when you're in it, that feels very different when you're not in it. And I can speak to that from my own experience with my own family, right? Why do I remember so much from my first child? We wrote everything down for my first child. I don't know if I remember everything for my second or third. We just weren't as diligent, right? And so some of the things, it becomes harder and harder to recall it accurately. I get corrected by my wife all the time. Um, some specific tools that you can use. Like I said, I put some paper forms that might be helpful into a box that you'd be able to access over the course of the next year from the date of this recording. I'm a big fan of just even throwing calendars on the fridge. Especially if there's challenger or crises that are not very frequent, but they are major when they do happen. Having this information like at the tip of your fingers is going to be helpful should it happen again, or as you're talking with people and being very clear about like what the patterns are that you're seeing. There are phone and tablet apps. I can't vouch for any of these. Some are free, some cost money. But if that's kind of like where you know that you're not going to lose it, that it's not going to get misplaced, where it's just your tech savvy and it's easier for you to do it that way, there certainly are tools out there that can help you do that. If we're going to put this all together, though, I would say like this all kind of needs to really kind of also culminate in some sort of response plan. You know, I always like to kind of like use this quote from like the Challenging Behavior Toolkit from the Autism Treatment Network, that for most families that we talk with, right, they're just trying to make sure everyone's safe. And it's really just not the time to teach like your child or your loved one make demands or even just kind of shape the behavior to do something different. And so the more intense it is, the more that you're not going to be remembering all of the things, but the more that you actually have talked these things out with the people that would probably be involved and shared it with providers or share it even after maybe one particular incident that we've come up with like this response plans that really kind of like details out what we're doing, what we're not doing, which I call triggers and glimmers, things that really signs that the situation is getting worse and what you would do if it does get worse, what you're doing before it gets worse, what you're doing after it's kind of like done, but also the glimmers of like, is there anything that we're doing that's going to soothe, calm, make your child feel safe? Putting this actually, again, all on paper, I put a link to like also an emergency profile sheet, because when I think about crises where it might be involving first responders, and again, there's things that we want them to do, not to do, and this is actually from the National Autism Association, but you can use it for whatever the developmental disability is that your child might be presenting with. And it does a good job of being relatively neutral, so it's not autism specific. And it outlines exactly something that you would be able to hand to somebody, either proactively through the National Autism Association has like this big red safety kit toolbox that they make free to families, which you could find on this website. And it provides like a number of different things. There's like the toolkit or the big red safety box itself. But there's other things that for families can download for things around safety for elopement, safety for crises, and some other additional resources. And I think that, many of these things are, essential components really for families to do when things are probably calm, and really kind of help shape all of the things that I just talked about in terms of being clear, concise, concrete, and kind of continual. It's a living plan. It kind of like details all these things that we want to have happen in the crisis so we don't forget, so we can review it, make sure we're in agreement about what we're going to do. If you have family members that are helping you out, if you have a crisis that starts to happen. And then, certainly helps maybe also, some of these things will help shape how you're going to kind of collect this information that makes it easy for a provider to know what to do next, right? So the more that we have the answer to those WH questions, the more that we have some numbers that you can help us put this on, some dates, it really paints a picture for us in our mind that would be different from what's in your mind. And our job, is certainly to help, provide therapeutic intervention, proactively provide support in the moment, if that's what we're able to access, and then recontinue perhaps therapeutic intervention or suggest other intervention, afterwards, after these crises are over. And that's all I have to share here for today.
Thank you so much, Dr. Ken, for sharing your information with us. We appreciate your time, taking time out of your busy schedule. At this time, we are going to move on to our next presenter, and it will be Jessica Wadington and Manny Rivera. I will share screen for you all. Thank you.
Hi, everyone. Well, while she's pulling up our PowerPoint, I just want to say again, thank you for having us here today to present to you guys. We're excited for the opportunity, and we hope that we can provide you something that is new or different that you don't already know. And then again, have questions at the end if anything, if we don't answer some of the questions that you came here with today. So just to reiterate, I'm Jessica Waddington. I work for the Office of Mental Health, and my coworker and colleague Manny Rivera is joining me today, and we both are focusing on children's services at the Office of Mental Health. But while we focus mostly on mental health and behavioral health, I think it's important to share and say that we also know people don't fit into one bucket, and that we, a lot of times when we're supporting the kids in Monroe County specifically, but in New York State, we're not just looking at serving kids who only struggle with mental health needs. We're trying to support kids who have behavioral health needs, special care needs, juvenile justice involvement, CPS involvement, all of the looking at the child as a whole. And so what we're hoping to cover today is, can you go to the next slide, please? I'm going to pass it over to Manny in a minute, and he is going to cover a little bit about services and resources. So he'll talk a little bit about SPOA if you're not familiar with that, and some of the services that the Office of Mental Health provides children in New York State. And then I will return and talk to you guys a little bit about some of the best practices or focuses on focus that the government has. So that's the State Office of Mental Health, but also the governor on improving mental health services in New York State moving forward. Next slide. So Manny, I'm going to pass it to you, and you can begin your portion. Oh, we can't hear you, Manny.
How's that?
Good to go.
Okay. I tried using this nice microphone, but I guess it's not working. So as we go to the next slide, I'm going to talk about some specific services that I can explain. And just please keep in mind, although all of these are going to be statewide services, not all of them are going to be available in every area. And that's why you would want to, when it comes to mental health concerns, be aware of who your single point of access or SPOA person is in your county, and you can contact them. So every county in New York has a SPOA. Sometimes, and it's all under the Office of Mental Health, sometimes in areas where maybe there aren't as many residents, or maybe they don't have as many referrals coming through or inquiries. The spokesperson, it might just be one person doing both adult and children's mental health consults and referrals. Here in Monroe County, we happen to have a lot, and so there's a few of us here that do specifically the child and youth single point of access. So it is supposed to be that single point of access. The idea that anyone can call or contact us with questions about mental health resources and supports and treatment, regardless of what other needs you may have going on, and we should be able to know the availability of local resources and how to access them. So we serve as a connection point and a consult to any family or treatment team. And that would be specific to your county. So, if you're in Westchester County, they have their own SPOA, and they can consult with any Westchester resident around mental health needs. We also attend meetings when there are children and family that have complex or multi-system needs. We can offer as a resource for mental health supports and a consult to those teams as well. We are supposed to be experts in our local resources and how to access them, and we serve as the local governing unit under the Office of Mental Health. Anyone can inquire with SPOA, and anyone can technically submit a referral to SPOA. In your county, there's no limits as to who can submit referrals for services under the Office of Mental Health. Sometimes there are requirements, though, that must be shown in the referral itself, but it doesn't need to come from a clinician, doesn't need to come from a doctor's office. We get calls from parents directly all the time. Once in a while, a youth will call, though that's a little more rare. Jessica included a link here in the slideshow. I'm actually wondering, maybe Jessica, you could paste that in the chat if you have it bookmarked. So this is just a reference for everyone to use to see who your local SPOA is by name, and also get their contact. If you'd be so kind, thank you. So some specific services that you might want to be aware of, and there is actually more than just, so we have a Medicaid service array. Medicaid services, there's a lot of acronyms. In fact, on that website that Jessica linked, there's also a link on there that has like all of the definitions of abbreviations. It's very difficult to keep up with if you don't know. So this stands for Medicaid services such as health home care management. There's an array of community-based services called Child Family Treatment Support Services, or CFTSS. There's also another array of community-based supports called Home and Community-Based Services, or HCBS. Your SPOA can link and take referrals for these services. Home and community-based services, most of the time we're linking families to that instead of doing direct referrals. And not all of these specific services exist in every place, so you have to check and see what's available in your county, in your area. We have equivalent services as well. A lot of counties have a non-Medicaid children's mental health care coordination program, and that's to offer support for families if they don't have a Medicaid policy, because commercial private insurances don't pay for these services. There are peer-based services for youth and families throughout New York. A lot of these, pretty much all of them, are going to be non-clinical support services that offer advocacy and mentorship from people who have their own lived experience. There are respite providers run by the office or authorized by the Office of Mental Health to temporarily provide safe housing to kids who need a break, a therapeutic break. I'm sure some folks on this call or on this webinar have heard of this or even used it. And we incorporate respite into a lot of our care plans just to allow for some space sometimes for things to cool down. We do take referrals for residential care. Those come through SPOA. So we have two levels of residential care. One is called a community residence or a group home, and the other is called a residential treatment facility, or RTF, if you may have heard of that. For those that are under the Office of Mental Health, you have to meet criteria with your psychiatric needs to qualify for those programs. And I always say my preference is to talk to families who are considering this, because of course no family wants to have to consider residential treatment for their kids. I myself have worked in residential treatment for children in both of those levels of care under the Office of Mental Health, so I have a pretty good idea of how things run day to day. I've seen things go not so well, I've seen things go really well, and it helps to have that experience to share with families, because a lot of their questions are more practical. What's this like day to day? What are my rights as a parent? And those things. So please involve your SPOA in any conversation where someone's asking about residential care options. They're going to be the folks to talk to about knowing your options and what's available. A newer program that also is not available everywhere, but there are a few counties that have it. It's called Youth Act, or it stands for Assertive Community Treatment. A lot of counties have an Adult Act program already, but this is new to New York State as of last year. And January 2023 was the rollout. This is a very interesting program. This is a full treatment team and community support team that is home-based. You can qualify for this only with your psychiatric needs. There is eligibility criteria that you have to check off for this, but the service itself comes with a med prescriber, individual therapy, family therapy, 24/7 crisis support, case planning, skill building, peer support for the youth, and peer support for the parent. Being eligible for OPWDD services doesn't mean you can't access Youth Act if you really need it. Also, you can be in foster care and access Youth Act. It really is primarily set up to treat kids at home with severe psychiatric needs. And so these are reserved for our highest needs youth, typically those who might pose danger to themselves or others, or have really hard to treat mental health, or also aren't willing or able to participate in available outpatient or community-based services in order to stabilize. Some other services that exist, home-based crisis intervention throughout New York State recently had some expansion to their cases, and so those teams are growing. This is an in-home crisis service that is a 6-week, pretty intense family therapy program. We often partner with home-based crisis intervention, for example, with kids coming out of the hospital or who maybe have a lot of suicidal behavior, really dangerous stuff going on at home. Home-based crisis intervention really tries to support the family to try and manage things at home and keep that person as safe as possible. There's also day treatment and therapeutic day school programs. A lot of you are going to be aware of those. There's some specialized settings that exist that can be accessed through school districts that partner and collaborate with the Office of Mental Health and treatment providers as well. And then there's mobile crisis teams, an extension of emergency departments where that's available. I know in our area, we would be calling either 911 or 211 or 988 to access the mobile crisis team. There are inpatient hospitalization settings for adolescents. Again, not everywhere, but in some places they do. We happen to have one here in Rochester, which is the University of Rochester's strong inpatient unit for children. And then there are some partial hospitalization programs as well, where you qualify with your psychiatric needs to attend a supplement for a school day. So you're bused to a program in the morning at a building separate from the actual hospital. And while you're there, they do tutoring, therapeutic activities, and actual clinical treatment with you for usually about 30 days at that partial hospitalization program. It's not overnight. You don't stay there. You go home after the day is done, but you receive pretty intensive treatment while you're in that program. And then mental health urgent care models. So these are areas where, and they're named different things in different areas, but they're starting to pop up more and more where there's actually a place you can go that is not the hospital to receive a mental health assessment during a crisis. And so we have, I know one through the University of Rochester here. And I know I've been aware of a couple others throughout New York State, but these are starting to become more popular as well. So kids and families don't have to go sit in the emergency room if it's avoidable or if it's not really necessary. And then 988 now is being used for Lifeline. This can be used as a suicide hotline as well. And this is where our mental health crisis calls. We're asking folks to try and use 888 for mental health crisis calls. Jessica, did I forget anything?
No, I don't think so.
Okay, good answer.
Thanks.
Thank
you, Mandy. So shifting from specific services and SPOA, what Manny just described, over to bigger picture practices and networks, I'm going to talk a little bit about what's going on in New York State in the world of mental health. So if you can go to the next slide. One of the things I wanted to share with you all today is that our governor has been looking at addressing the mental health crisis in New York. And if you're not familiar, I included a link with much more information than what I'm going to cover today. But she held a listening tour over New York State where she gathered youth in a setting to ask specific questions around their mental health needs and what they recommend or need to help address what the needs that they have. The report that's linked here talks a little bit about what the youth themselves identified. And some of the messages or themes that they shared in these listening tours was that the impact on their mental health really varied over time. And we're specifically talking about following the pandemic, the COVID pandemic, but also the public health crisis of racism that we've experienced the past few years. And so they said our mental health there is impacted over time, and it really varies, and it's dependent on what's happening in that moment. They also shared a little bit about the focus on social media and how social media affects youth mental health. They really shared the challenges that they had with social settings and making positive peer relationships. and they expressed wanting to have interactions with trusted adults who are like them demographically and in age. And so they advocated strongly for more peer support services within the mental health system as well. So you can see here, I put two specific bullet points out of the listening tours in the report that the governor shared with us. There's two big, what's the word? Recommendations that the governor is pushing forward. One is that she's hoping to establish and expand school-based mental health clinics. And so we all know that there are mental health clinics in the community, and those clinics are now offering telehealth and in-person sessions. But to expand or to break down barriers to accessing treatment and expand access to treatment, a lot of those clinics are establishing offices, what we call satellite offices, in school buildings, so that students can attend the mental health treatment during their school day to eliminate barriers around transportation or availability, just having not having enough weekend hours or evening hours in the regular clinic setting. So they are establishing these satellite offices in the schools where more youth can be served. They're also expanding inpatient mental health services, and that is specifically in response to the number of youth who are in crisis who may end up, as Manny was describing, in CPEP or in the emergency room and are in need of inpatient setting, but are having to wait in the emergency room to be admitted into the unit because of the number of youth who are unfortunately in the unit at that time. And so those are the two things that I felt was important to share with you guys today that the governor is working on based on this report. And I would encourage you guys to look at it if you have a chance, because it has a lot more good information on what youth are saying they need or want for mental health services here in New York. The other thing I wanted to share with you guys is the New York State Office of Mental Health System of Care values, and I also included the link here for you to visit on your own time. But system of care is a framework. It is a set of values that helps guide the work that the professionals do for children and youth who are receiving services that are under the OMH umbrella. And really why I'm sharing this with you today is because all of those things that Manny has talked about earlier in our presentation, those should be operating under these values in this framework. So you should be able to feel valued and as a equal partner in your treatment or services if you are a family member or a youth yourself engaging in those services. The link that I shared with you actually has some of the pilot projects that the System of Care Network is doing. One of those includes action planning. So they're helping all of the counties have the opportunity to use them for support in creating action plans on how to make sure that these values are implemented across services in their county. There's also high fidelity wraparound programs. They're doing trainings to help like health home care managers or care coordinators learn the high fidelity wraparound model and how to implement that for the families they're serving. They offer support around the SHAPE assessment. A SHAPE assessment is a evaluation tool that schools use to determine what type of supports they already offer for kids with mental health needs in their buildings, but then also where are the gaps and how can they make connections to fill those gaps so that when students have mental health needs in their buildings, that they are able to help support them so that they can be effective in their academic schooling. And then they focus on peer services as well. The next slide I have here shares what those system of care values are. So the first one is youth guided, making sure that youth voices are heard. That's very important to us, especially I know here in Monroe County, we really want to hear it directly from the youth and then not just hear what they say, but use their feedback to implement system and policy change. Family driven, so that we're listening to what the families are, what's the goal from the families? What do they want their life to look like? What do they need right now? Trauma informed, to make sure that when we're providing services to youth and family that we're considering what traumatic experiences they might have and not doing anything that would exacerbate that. culturally and linguistically competent. So making sure that we're aware of people's cultural needs and wishes, and that we're honoring them and respecting them, and that we're asking questions and trying to learn when we don't know enough about someone's cultural background. But then also, for example, making sure we have available interpreting services when someone speaks a different language, many of those things. Community-based, we want to make sure that the services that we're offering, and you heard today from Manny, that many of them are in the community, that we're not making kids and families come to our services, that we're able to reach them at their homes if they prefer, or in the community, and really eliminating any barriers to treatment. And then best practice oriented, so really just trying to figure out, are the services that we're providing quality services, and are they going to meet the need that the family is presenting to us? The last slide I'll show you is just training and networks and information I wanted to share with you guys. And the first one is the Trauma Informed Network Resource Center. That's a consortium of people who serve kids and families and adults in New York State. And they get together occasionally and share information about trauma-informed practices and what they're doing in different counties. This is New York statewide as well. So what they're doing in different counties, what initiatives are happening, tools that they're using. It's really a great network. So if you're interested in that topic, you can click the link, and there's information on how to become like a member and get a part of the distribution list to get their information. SIGTAC, the second one listed there, is a training website it's specific for people who are working through like OMH or OASIS or OCFS systems. But I knew that some of you here might be involved or it identifies working in those systems. So I wanted to share that with you. They have many self-paced trainings, but also live action trainings that you can attend on different topics. Some of the best practices that are for youth who are in mental health crisis and things like that. The last two I have listed here are different resources that have different handouts and information, articles, trainings that, again, just focus on youth and children and the mental health needs in our area. And I thought that would be helpful for you guys to be able to use if you're looking for different information. A lot of the times, if you visit like the National Child Traumatic Stress Network, you can search a topic like COVID or grief and loss, and they have a lot of tip sheets and talking points and things like that that might be helpful information on how developmental age, what it might be like, for example, for someone to grieve who's 5 versus a teen who's 17, and what to be looking for, that kind of information. So that's all we had here today. I know we wanted to keep opportunity for question and answer, so I thank you for letting us go a little bit over, I think 20 minutes if we did. But please let us know if you have any questions. We're here to follow up on anything we didn't cover.
Thank you both. Thank you both. At this time, we are going to prepare for question and answer. And so I'll ask those who are monitoring the chat to please assist us with that at this time.
I know I've been answering the questions in writing as we've been going, I think.
Okay. Okay. Any other questions? Have any other questions come up in the chat from my peers and co-host? Okay, perfect. Okay, perfect. Okay.
Oh, Jessica, there's a question. Can you explain high fidelity wraparound? Do you want to field that one?
Sure. Yes, I'll do my best. If you do, so just so you know, I saw something about the links not working. So if it's the links on our PowerPoint that are not working, I'm happy to send them to whoever or do something to get them. I tested them out myself this morning, but if there's a issue, please let me know. High fidelity wraparound really is an approach to that care management or care coordination service. And really what it looks for is creating a team-based planning process for those families. And it's not focused on solely connecting to services. So, not to minimize all of the work that like a health home care manager or a care coordinator does, but a lot of times when they are meeting with families, they're looking at what service can I connect to someone that that would meet the need that they're presenting with me today. So you might connect to those CFTSS services that Manny was talking about. High fidelity wraparound is really going to look at what happens when all of the services leave our family. So creating that natural team support or the natural supporters around them that are going to be exist in their life going forward when all services exit. So helping them, you know, if a family is saying, I need a break, a parent might be saying, I need a break, I need a break. Someone trained in the high fidelity wraparound process is going to look at natural supports in their life and family members, friends, churches, things like that, that are going to be able to continue that respite service for them beyond the time of a service being implemented to that family. They also really value the team-based planning process. And so when they're having planning conversations around goals for the family and needs for the family and strengths of the family, they're going to have all of the team in the meeting. So it's not going to just be one, service provider and the parent and child. It would be whoever the family identified as a part of their team. So it could be their psychiatrist, their therapist, their school counselor or principal, and their neighbor and their church pastor, whoever they identify. But each meeting is going to be a team approach. So it's a big commitment from families to and their natural supports to be able to sit in those meetings regularly as a team and not just these independent conversations and trying to bring them all together. So I hope that helps a little bit. There is more information. I don't know, Manny, if you would add anything to that. But there is more information on the New York State System of Care website. When you open the page and you look in the middle of the page, it says high fidelity wraparound, learn more. And then it has a whole page of more information around what that looks like.
We do have a question in the chat asking, where can I find a psychiatrist for my son and a neurologist? And so I would pitch that out to all the panelists, if you guys can chime in on that.
So really, it depends on where you live and what's around, because there's going to be different providers in different areas. Typically, for psychiatric care for children, that would be done through an outpatient clinic most often, where a kid would enroll in treatment. They would be receiving therapy and then consult with a psychiatrist in the same clinic. Usually, that's how it goes. So my suggestion would be in your local area, if you were to Google search outpatient mental health clinics, or if you were to contact your office of mental health to find out what's around, either way, you could ask about wait times, you could check it out, and then get your child enrolled into their outpatient treatment where they would be receiving therapy and psychiatric care. For neurology specifically, I'd probably suggest, and this could also apply for therapy and psychiatry, talking to your doctor. Talk to your doctor first, your primary care physician, pediatrician for your child. They're often going to have good relationships with local providers. They're going to know, to a degree, who's around and what kind of needs they serve. And if there's a neurological issue, they're going to need to most likely hear from the primary care doctor anyway. That'd be a great place to start. And additionally, I kind of forgot to mention this too. A lot of pediatric clinics are starting to employ mental health clinicians of their own, or like social workers of their own, to assist families with some of these processes of referring to other places, accessing treatment and things like that.
There are also private psychiatrists who don't work in a clinic. I think, at least I know from Monroe region, but I'm imagining across the state, it is harder to find private psychiatrists who serve children. There's a shortage of psychiatrists. So that is why I think we naturally lend ourselves to share information about clinics, because we know that each of the clinics have a psychiatrist and that they can be seen regularly with that person.
Okay, another question we have you seen the use of 988 de-escalate many situations that may otherwise be escalated with a 911 call due to mental health crisis?
Specifically, like in specific instances, I wouldn't necessarily know if the family called 988, but what I would say to try and answer that question is we have seen a lot of instances where folks like mobile crisis or some other kind of like mental health crisis team that can be accessed through either 911 or 988 respond when police didn't have to. And that's always the preference. If the police don't have to respond, I'm sure they'd rather not. If there's please, if you can learn about mental health crisis services in your area, we mentioned a few: mobile crisis, not an immediate solution, but home-based crisis intervention. But 988 is a great place to call if you're not sure exactly who can respond instead of police. But yes, it's gone really well when we've been able to use those services.
Thank you. We've had this question come up a few times about waitlisted. Um, does anyone have any strategies for folks who have been waitlisted to see a developmental specialist or pediatricians? Is there some place they can go or information they can access?
I think for yeah, I was gonna say for waitlist, and I think that question was specifically about developmental providers, and so I can't speak to that as much. But in Monroe, or at least in Monroe County, when it's a mental health service that someone's waiting for, that's a lot of the times when our SPOA gets involved, and they try to be creative in planning around filling the gap of while they're waiting. So again, it would be problem solving around, is there another service they could use while they're waiting in the interim? Is there a natural person they can provide? It's a lot of conversations and planning, and we sit at the table for with these families and help them plan in the moment so that they're not feeling like they're just left waiting. Unfortunately, the systems are all strained, like residential and OMH and CPS and juvenile justice. All of these systems are strained, and I think there's wait lists. People are experiencing wait lists across the board, and it's hard for us because we feel the hopelessness and desperation from the families, and we want to do the best we can. So we try to be problem solve with the families around what we can do in the interim. I don't know if someone else on the panel can speak directly to the developmental services that the question was referring to.
I mean, I can also unfortunately reiterate, I think everyone's experiences here that, at least maybe not again Rockland, but I would say our wait times are even way more significant than 3 to 4 months, which actually reflects a national problem when I talk to colleagues elsewhere as well. And I do think that typically at this point, let me just say this: I don't necessarily have like a perfect answer for like what you can do for a long wait time in Rockland. I think that would maybe be like a longer conversation, perhaps, which I'd be happy to even connect you to, someone within our clinic that could maybe help answer that question perhaps better than I could. Our social work team here certainly would be happy to, given that we do the majority of developmental evaluations or diagnostic evaluations, certainly for upstate New York here at the University of Rochester Medical Center. So I would say that if you wanted to talk about with someone about like some things that you potentially could do in the meantime, like we do talk to families a lot about what you can do in the meantime while you're waiting for quote unquote a diagnosis or an evaluation. You certainly could, again, I would actually just ask to talk with social work here at the University of Rochester Medical Center and developmental and behavioral pediatrics, and be happy to talk with you a little bit more. But there is no long-term answer or quick answer for like what we could do to reduce wait times. Everyone's scrambling, I would say.
Thank you so much. We are at 12:59. I do not want to hold you past your time. I want to thank everyone for attending our webinar on today. Thank you so much to our esteemed panelists. You all were amazing and provided so much information for us to share. We would like to invite everyone, please save the date. We will have behavioral supports in schools coming up on June 18th. That will be at 12:30. Save the date, mark your calendars for this next webinar that will be coming up. We will be sharing information out concerning this. Thank you all so much. And we will ask you to please complete our survey. I have shared the link for our survey on today's webinar in the chat. Again, we want to thank you all for attending today. We hope you have gotten some valuable information. And again, thank you to our esteemed panelists for all of all the information and strategies you shared on this very, very, very important topic. Thank you all. We hope you have an amazing day. If your questions were not answered, we will direct them to the proper panelists so that they can provide some information and feedback for you. Thank you all again, and enjoy the rest of your day.